how do you collect and process that colostrum is very important. Reducing contamination with bacteria that can grow in that colostrum really quickly is important, because the more contamination with bacteria you have in there, the less it's going to absorb IgG. And we know this. One of the biggest signals that promotes gut closure and reduce absorption of these immunoglobulins is contamination with bacteria. And then you can say with a good quality colostrum, but if it gets contaminated, that animal is not going to absorb that much IgG. So his passive transfer is going to be compromised as well.
Welcome to the Feed Science Podcast Show. I'm Adam Fahrenholz, coming to you from North Carolina State University and our animal food manufacturing program here, housed in the Preston Department of Poultry Science. Thanks, as always, for joining us. We appreciate all of our subscribers and listeners on various podcast apps, as well as watchers on YouTube. Today, we have a repeat guest, so real excited for that. Our guest is Dr. Lautaro Cangiano. Lautaro is an assistant professor focusing on bovine immunology at the University of Wisconsin-Madison. And we're going to talk today some things about early stage immunity and colostrum in calves. So, Lautaro, thanks for joining us again.
Yeah, thanks for having me. Yeah, it's always a pleasure.
Yeah, you bet. So if you wouldn't mind, for those that may not have caught a previous podcast, just give us a brief introduction on your background and how you came to be doing what you're doing today.
Yeah, absolutely. So as you said, I'm an assistant professor in the Department of Animal Dairy Sciences here in Wisconsin. I primarily work on bovine immunology, and then the different transition periods these animals go through and how that impacts the immune system. So we work in early life, a lot on colostrum management, and then how colostrum helps the calf, not only provides passive protection, but kind of like recalibrates how that immune system develops and functions in that early period that is very critical. And then some on weaning as well. That's another transition that is very important, that impacts gut health. And then on transition cows, in transition dairy cows, as they transition from dry to lactating cows, and all those metabolic changes that they occur, also seems to affect immune function. So we kind of like work on those three transition phases, how it affects immune function, and then maybe the most important is how, from a management perspective, we can try to improve some of these health-related outcomes in the animal.
Very good. Very good. So obviously from the kind of the feed science perspective kind of things, we talk a lot about the different ways that we introduce nutrition to the animals. And we talk about that obviously in the dairy side on lactation and in dry periods and all those different things, and supplementation and high quality forages, TMRs. But there's a really specific thing that we have to make sure we do well. And that's at that very beginning stage of transferring that immunity. And we obviously have different practices depending on what types of systems we're in, whether that be things related to beef cattle or dairy cattle. And sometimes we're leaving calves on cows for relatively long periods of time. Sometimes we're pulling them very early. And so depending on that, we know that we have this impact or can have this impact on immunity. And we know a lot of that has to do with colostrum. So let's just jump right in there. And so can you explain why the colostrum management is so critical in those first hours of that newborn's calf life? And then how have we evolved the management of that over time, long period of time, and anything? And then is there anything particularly new in the last few years?
Yeah, absolutely. So colostrum, I think, is the cornerstone of management of neonatal calves, especially on dairy calves. So we've come, I think, a long way in management of colostrum over the last 10, 15 years with work from a lot of people, but Sandra Godden in particular from Minnesota, Mike Steele, which he was my former PhD advisor in Guelph, and a lot of other people as well. But I think one of the biggest things is we have defined new thresholds of what we consider a successful passive transfer. So for those of you that are not very familiar with this concept, passive transfer is the transfer of immunoglobulins that are present in the colostrum into the calf, and then how much of that we need in order to protect that animal over the first couple of weeks to 1 to 2 months of life, until that animal is able to mount its own effective responses against whatever infection that animal might be dealing with. In ruminants, in contrast to in humans or some other primates, there's no transfer of immunoglobulins or some other immune factors through the placenta when that calf is still in utero. So the calf, when it's born, it has to acquire all those factors exclusively through the colostrum. So colostrum management is directly correlated to incidence of disease of these animals. But not only that, it also affects the growth rates of these animals and even long-term aspects like future milk production, which is incredible. I always talk in class that I don't know of any management period that you only apply once to an animal, the first day of life, that has such remarkable contributions over the lifespan of that animal. And some of that, it has to do with passive transfer. Some of that has to do with the immense amount of bioactive factors that are present in that colostrum, growth factors like growth hormone, insulin, IGF-1, cytokines that are there, to jumpstart the developmental trajectory of that animal once it's born. And one of those is the immune system of the calf. And we know now that there are a lot of bioactive factors there that contribute on how that early immune responses are going to look like after the calf is born. But maybe going to the basics, we have now very defined guidelines of what we consider successful passive transfer. And there's a direct correlation between immunoglobulin concentration in circulation in these calves at 24 hours of age with incidence of disease. The more you achieve to get into the animal, the less incidence of respiratory and diarrhea cases you're going to observe. And this is from actual data. We have retrospective data showing either if you feed once or twice, two feedings of colostrum, or if the animal has 150 versus 200 or 250 grams of IgG in circulation, there's a direct correlation there. And then based on all of that, they has come out with new benchmarks or standards. There's a paper done by Lombard he used to work for USDA that is published in JDS, that it's kind of like our gold standard of what are the benchmarks we're trying to achieve in dairy calves. But as I said, beyond that, some of the other stuff is how fast we can get the colostrum into the animal. So we have to start with a colostrum that has a good concentration of IgG, and what we consider is more than 50 or 60 grams of IgG per liter. And then we're trying to feed between 10 and 12% of their birth body weight within the first 4 hours of life, I would say. So when the calf is born, as hours go by, it has the capacity to absorb those immunoglobulins it's reduced. So we need to feed it as soon as possible. And then typically calves won't drink 4 liters by themselves. So typically we suggest producers to just tube that colostrum. And it's an easier management practice than just waiting with the bottle in there and then not being able to achieve to get to that 10, 12%. There's benefits of doing a second feeding if you can, but at least guaranteeing that you have good quality of colostrum of roughly 10, 20% of their body weight in there as fast as you can That's going to guarantee that you have lower morbidity in your herd. What else? Then how do you collect and process that colostrum is very important. Reducing contamination with bacteria that can grow in that colostrum really quickly is important, because the more contamination with bacteria you have in there, the less it's going to absorb IgG. And we know this. One of the biggest signals that promotes gut closure and reduce absorption of these immunoglobulins is contamination with bacteria. And then you can say with a good quality colostrum, but if it gets contaminated, that animal is not going to absorb that much IgG. So his passive transfer is going to be compromised as well. So that's kind of like the main pillars, is starting with a good quality colostrum, feeding it as soon as you can, and then making sure that all the process of collection, if you pasture that colostrum, that is done properly, and then you deliver an optimal product to that animal.
Gotcha. So, and you mentioned a few times in there the idea of, and I think this is the historical, kind of understanding. You mentioned that concept of that passive immunity, that passive transfer of immunity going to the calf. But my understanding, and from some of the research that's out there and some of what you just touched on just briefly there, and I'd like to get a little more into it, is what research, what lessons are kind of coming out about those other benefits beyond just the immunity transfer. I think things related to the gut health. You mentioned growth factors and overall growth, long-term performance, that it's not. We always know that with any young animal, getting them started off correctly is important. We've always known that. But what is the research showing about those actual definable impacts on long-term growth, long-term health of the animal?
Yeah. So as we alluded before, like we've seen for a long time now, these long-term effects of colostrum on growth, performance, future milk production. And although probably some of that has to do with reducing incidence of disease just by passive transfer, probably doesn't encompass the full benefit of that colostrum. So there's a lot of bioactive components in there that have shown that, for example, IGF-1 and insulin, they stimulate locally in the gut development of the intestinal barrier, more epithelial cell growth in the gut. So that probably has to do a lot with improving absorption of nutrients at that early period, and then contributing to that gain. But besides what specific component or bioactive factor is doing what, is moving more into the focus on what happens to the animal specifically. So it's specifically related to immune function. In a recent study that we just published, it's accepted, but it's not yet on the JDS repository. We shown that it has a huge impact on modulating how the immune system of that calf develops over time. And then specifically, we had this study that we've had a group of calves fed colostrum and a group of calves that didn't receive any colostrum at all. And then we had to keep them on a biosafety contained location in order to keep the no colostrum calves alive and healthy, so that we could compare what differences we observe in the immune system of these animals. And then what we can see is it has a huge impact and it controls what are the main lymphocyte subsets in circulation in early life, and it reduces on the innate immune system a lot of inflammatory pathways, which we're really surprised. And then, for example, the neutrophils from calves that are fed colostrum, they're less active compared to the no colostrum calves, which was kind of like contradicted to what we were thinking before. But we started looking more into this in the literature, in mice models, in humans, and this actually makes a lot of sense, because when an animal is born, it goes from a sterile environment in the uterus to the outside world that is filled with microbes and antigens and nasty stuff but also commensal microbes that are very beneficial for an animal as it's developing in the gut. So that immune system, it has to learn to be prepared to what it needs to react and what is just a normal commensal member of its intestinal microbiome. So those interactions needs to be established, and Colostrum seems to be guiding some of those responses. And it kind of like the theme here appears to be that Colostrum provides protection for that early period, but it's also programming how that immune system functions over time and kind of like taming down a lot of the more aggressive inflammatory pathways when it's not needed. And then in the meantime, it's protecting the calf by factors that are passed on by mom in that colostrum, right? To kind of like train the immune system slowly to recognize where it needs to react and when just can be chill and cool down and doesn't need to be overreactive. And what we see in the calves that don't receive colostrum is a lot of inflammatory pathways are upregulated. When you pull neutrophils out and you activate them, they're very aggressive, has a lot of phagocytosis and oxidative burst that are kind of like the two main mechanisms neutrophils deploy to respond against infections. So, and also related to the adaptive immunity, we also see the colostrum seems to be promoting B cell development and also altering this is more specific, but also altering kind of like the subsets of T cells that are more dominant in that early period. So overall, it's contributing and dictating how that early development of the immune system or that trajectory works, and then taming down a lot of inflammatory responses, which was really cool.
Gotcha. Okay. Very cool. Very cool. Again, my guest today is Dr. Lautaro Cangiano. He is working in the area of bovine immunity and is at the University of Wisconsin in Madison. So we've got a little less than 10 minutes left or so. And I think spend the last bit of our discussion here then on, all right, you've talked about obviously the kind of historical importance of colostrum, and you've talked about how it's important to have good quality, good delivery, good management practices there, and then some of the additional benefits that we are seeing long term that you're now able to pick up through these different research protocols. So I guess the way to finish this out then is to talk about what do you see as kind of the next big breakthroughs in this area, the next big breakthroughs in colostrum research or the management practices that people are doing, and how might they over time actually change the way that we're seeing farms, large, small, of all different shapes and sizes. How might we see some of those things change the way they operate over time?
Yeah, I think being able to maybe extend colostrum feeding on these farms might be something that we try to implement more broadly. So in dairy cows, once the animal calf, what we consider colostrum is that first milking. That's the only thing we consider colostrum. But that cow doesn't go from producing colostrum to producing whole milk that goes off and is sold as sellable milk. There's a transition phase in there that all those important bioactives and IgGs are gradually diluted until we get what we consider mature milk or whole milk, that is that sellable product that farmer can sell off. Typically, that transition milk, it's put away with the hospital milk or the waste milk, and it's fed to calves in there. But I think we're losing a lot of value in that product that could be fed to the calves on those first couple of days. Because if you think calf raised on pasture by mom or like in a natural environment, that calf would be receiving the colostrum, but also be receiving all these other transition milks for that first couple of days that we are not being able to feed under our current management practice. And I understand it's very difficult to do so in an individualized basis because you either need to have a different milk tank to milk those cows. Typically, most farms, what they do is they'll wait and they'll bring those cows that just calf. And then pass them through the milking units and then collect that and then just dump it in the waste milk. But if we can find ways of individualized feeding, or like maybe milk those cows separately, harvest that and feed it to those calves in the first week of life, we can probably see a lot of benefits. There are studies that they've done that, or they try to create their own transition milk by combining whole milk or milk replacer with colostrum replacer, and then feed it to the cows for an extended period of time, either a week, 2 weeks, and they see a lot of benefits in that. Either, for example, feeding it for 2 weeks, they show improved growth, but also reductions on diarrhea and respiratory disorders. And if you think about it, although the calf is not able to absorb IgGs anymore past 48 hours, 24 hours, those factors can still have a lot of local effects. IgG can still bind to pathogens in the gut and help with excretion of that, preventing infections from ever occurring in the gut. And also those bioactive factors can have local effects, promoting proper development of the gut. And we've seen that in some studies, that if you extend feeding, you have improvement on gut barrier development, improvement on cell proliferation and villi development. So potentially these calves could be absorbing better the nutrients and also developing an intestinal barrier that it's better prepared to deal with specific pathogens. So I think we have to find ways. One easy or easier way is just creating this colostrum, this transition milk using colostrum replacer that can just be added in the milk. But that might not work for everyone. And then finding ways that we can use this transition milk, I think could be important.
Very interesting stuff. I think it's an interesting thing to hear about, kind of from our perspective, and hopefully from my perspective, and hopefully also from the audience in general. Like I said, a lot of what we talk about here is kind of the feeding for growth and the obvious manufactured feeds and things like that we are feeding to these various animals. But this is one of those things that is basically, even though it's something that if a calf is on mom for a certain amount of time is not something we think about in feeding. In this way, it absolutely is, because this is something that we are responsible for as the producer, and so it's kind of the first feeding we do for these calves, and so it kind of falls into that area for sure.
Yeah, and it might not be that important for beef animals because beef calves stay with mom for a long period of time. But in dairy, that you remove the calf from the dam at birth, finding ways of providing those components, I think it's important.
It's time for our famous three.
Wisenetics turns podcast airtime into brand authority. We don't sell ads, we elevate voices. Curious how far your voice can go to become a reference in the industry and attract more leads? Scan the QR code and discover how we can turn your expertise into unmatched brand authority. Let's transform expertise into influence, starting now.
Well, we're at the end of our time, but it's been a while. I think it's been about a year since we've had you on the podcast, and so similar to what we would have done the first time around, we always ask our guests if there's anything else they'd like to share or talk about, especially in the area of like good resources that they've come across recently, things they've read or things they've found that they've found to subscribe to online, or things like that they think people might be particularly interested in. If you find more interest in this topic, good places to go learn more. So if you have any thoughts on something like that, we'd be glad to hear them.
For us in dairy, a really valuable resource for us is the Journal of Dairy Science. that is there's the main journal we published on, and then there's a lot of really good work in there, and then they're constantly publishing new stuff on this area. I know for a lot of people that maybe don't work in science, my thing is a little scary but building or getting used to, I think it's important. There's also, I've seen and come across a lot of people in LinkedIn especially that they kind of like try to digest some of the main aspects of this research, and they publish that in just like a brief summary, kind of like more digested for the general public. That I've come across recently that could be good. So maybe having an online presence in LinkedIn and following some of these people could be a good way to stay updated. There's a lot of that. I'm not going to like name one specifically, but I think that's useful. And it's even useful for me, right? Like I go through and I see some of this stuff. I share with my students, or I find a nice perspective on something we've already seen, or like is a good space for discussion, I think, right now. I think Twitter used to be that in the past. And for reasons I'm not going to get into, I think like LinkedIn it's less hostile environment to have discussions about this, which is kind of nice. Yeah.
Yep. I think that's a great point. Very good. All right, my guest today has been Dr. Lautaro Cangiano, assistant professor working in bovine immunology at University of Wisconsin-Madison. Lautaro, thanks very much for joining us. I really enjoyed the conversation, and we'll look forward to having you on for a third time sometime here in the future.
Thank you. Thank you for having me. Always a pleasure.
Yeah. This has been the Feed Science Podcast Show. I'm Adam Fairnholz from North Carolina State University. Thanks a lot for listening. Please do like, subscribe, make comments, whether it be YouTube or your favorite podcasting app. We'd like to hear from the audience what you guys are liking, what you guys would like to see us focus on. And until then, we will talk to you the next time.